Hi, I'm Dr. Noor Nazaliza, oral pathology and oral medicine specialist from Ministry of Health Malaysia. Diagnosing lesion in the mouth as early as possible is very important. The earlier lesion is diagnosed, the faster treatment and healing can begin. Through this video, I'm going to show how to systematically examine the oral cavity in order to detect any oral potentially malignant lesions or early cancer. Just follow these 10 simple steps for mucosal examinations of the oral cavity.
Step 1. Examine the lips. Look for any abnormalities in the texture, color, and surface of the lips. Step 2. Retract the lower lip. Examine the anterior lower labial mucosa, labial sulcus, and the alveolus. Step 3. Retract the upper lip. Examine the anterior upper labial mucosa, labial sulcus, and alveolus. Step 4. Retract the right cheek and visualize the right buccal mucosa, right lower and upper sulcus. Examinations of the entire buccal mucosa should extend from the commissure to the anterior tonsillar pillar. Step 5. Repeat for left buccal mucosa. Retract the left cheek to visualize the left buccal mucosa, left lower and upper sulcus. Step 6. Examine the hard palate with the patient's mouth wide open. Examine the soft palate by depressing the tongue with a tongue depressor. Step 7. Examine the lower right lingual alveolar mucosa and right floor of the mouth. Then, instruct the patient to lift the tongue up to visualize the anterior floor of the mouth and examine the anterior lower lingual alveolar mucosa. Step 9. Repeat Step 7 to examine the lower left lingual alveolar mucosa and left floor of the mouth. Next, palpate the floor of the mouth. Lastly, examination of the tongue. Examination from the tip to the dorsum of the tongue as well as the base of the tongue. Have the patient stick out the tongue and wrap the tongue with a dry gauze. The tongue should be deflected to the side to visualize the right and left ventral. And finally, palpate the dorsum of the tongue for any abnormalities.